Hi everyone, this is Kate Warnock coming to you from the garage space of the Guidewell Innovation Center. Delighted to have back one of our favorite guests, Jason Altmire. Jason, welcome to the interview.
Glad to be here, thank you.
So Jason's title is the Senior Vice President of Public Policy and Community Engagement for Guidewell. All right, so Jason, we're in this time of extraordinary change, and with all of the uncertainty around legislation at the national level, what do you really think is going to happen within our own state of Florida?
Well, when you look at what's happening in the Congress, I think they're finally getting down to the business of taking a look at the ACA and thinking about what the replacement means. And what that means is it's not as easy as it seems. It's easy to talk about doing away with something, but when you have a law that's been in place for 7 years, you have exchanges that have been working for 4 years, you have 22 million people that are insured through those exchanges, you have millions more that have been insured through the Medicaid expansion. I think that the Congress is finally starting to realize that they are going to have to take a deep look at the policy of health care reform, and if they want to make changes to the ACA, to do it in a way that doesn't completely disrupt the market, because the last thing you want to have happen is rates to go up, millions of people thrown off the insurance rolls, and then you have a bigger problem than you had to start.
Do you think that anything will remain unchanged within Florida, as far as the law itself? Is there something that you predict will probably stay in place?
I think something that I'm excited about is the Medicaid expansion that the legislature has decided not to do over the past several years. I think it's very much in play now because you have a different mindset in Washington. They are probably going to do block grants for Medicaid, which means the states will have a lot more flexibility in the way they administer the program. The other side, they're probably going to have a lot less money, so you may have less people that are insured overall than would otherwise have been. But because the Florida legislature did not expand Medicaid to begin with, I think we're actually in a better position now to take advantage of the block grant, because we're probably going to have an expansion of coverage throughout Florida, whereas other states that expanded before might not have the same outcome.
Interesting. Okay, that's good to know. Well, Jason, we had you recently speak to us after the 2016 Cancer Immersion event here at the Guidewell Innovation Center, and you shared where you thought legislation really could help improve the cancer patient experience. Do you see any way that legislation could also possibly improve behavioral health and patients' experience in that?
It's a critical part of healthcare, and the great thing about healthcare policy in Washington and in the states is people understand now that physical health in large part is also driven by mental health. And the fact that behavioral health is a part of that discussion, making sure that it's on a level playing field with other types of healthcare treatments and through the insurance program, I think we've come a long way in this country. And when you think about take another look at the ACA, revitalizing that program and going in a different direction, the behavioral health aspect is very much a part of that conversation. So if we had had this conversation 15 years ago, probably that wouldn't have been the case. But now I think people understand it's a critical component of healthcare moving forward.
Very good. Well, the last question I have for you is, you are the chairman of the board for the Florida Blue Foundation, and in just a couple months they're going to be hosting the Sapphire Symposium. Right. The symposium's focus is creating a culture of health, which is a great topic. Can you explain why that topic is so timely and what the role Guidewell plays in building that culture?
Sapphire Awards is a great program. It's all across the state, everywhere from the Keys to Pensacola, taking a look at the organizations that are in those communities making a difference, improving the health care and the lives of the people that live in Florida. And for 11 years now, going on 12 years, this is something that we've done to recognize and reward the charitable organizations throughout the state that have done a great job and deserve exemplary recognition, but also to provide a symposium where people can learn about the issues. And what you're talking about this year, we've decided to talk about prevention and wellness and health policy and what local communities can do. So it's something that just because you're not an awardee this year or you're not nominated for an award doesn't mean there's not something that is of great interest to you, because that symposium is going to be something that everyone across the state can learn from when they look at the best practices throughout Florida.
Terrific. Well, a wonderful event that you're hosting, and I think this is at least 10 years. Are you into
your 12?
12 years.
Yeah.
So a lot of knowledge that you have shared with some of our most important community partners too present. So, well, Jason, thank you for your time today.
Thanks.
My name is Kate Warnock. Thank you for watching.